There is a lot of misconception and some harmful practices going on in the street with regards to convulsion, because I have seen a lot of cases where convulsing patients get injured because of the intervention given to them while convulsing. And these interventions were coming from knowledge that has been passed from generation to generation in the street without any scientific basis and without any productive effect. Okay, so today in this video I want to show you all those misconceptions and harmful practices that you should never practice, that you should avoid for a convulsing patient. Because of this, I will also show you what you should do to save that patient. Okay, now to start with, we want to understand what is convulsion and what is seizure. So convulsion is uncoordinated body movement and limb movement with other manifestations as a result of repeated and rapid uncoordinated muscular contraction and relaxation. Okay, so this is the manifestation, this is what you see, and they call it convulsion. Okay, now what is seizure? Seizure is an abnormal electrical activity going on in the brain. So it is seizure that causes what? Convulsion. Okay, so I hope that is clear. Now, what are the things that can cause convulsion? Number one is head trauma. Okay, that is head injury. Any head injury from road traffic accidents, from home, from fall on ties, etc., can cause what? Convulsion. Now, if there is infection in the head, it could be inside the brain, it could be on the lining of the brain, that is the meninges that covers the brain. So if it is in the brain, it is encephalitis, and it can cause what? Convulsion. Encephalitis, it can cause convulsion. Then if it is on the meninges, it is meningitis. Now, if it is tumor in the brain tumor can cause what? Convulsion. Okay, so these are the things in the brain that can cause convulsion. Also, stroke can cause convulsion. Okay, all right, so these are the things in the head that can cause convulsion. Number 6 is what? Severe or cerebral malaria. Okay, cerebral malaria. It can cause convulsion, multiple convulsion. Electrolyte imbalance can cause convulsion. Electrolyte imbalance can cause what? Convulsion. Okay. Number 8, high temperature, very high temperature, that is high fever, can cause what? Convulsion. Low blood sugar, very low blood sugar can cause convulsion. Okay, now substance abuse, alcohol and other drugs, heroin and cocaine, can cause what? Convulsion. Abuse of what? Substance can cause convulsion. Alcohol withdrawal to save space. Alcohol withdrawal can cause convulsion. Dementia, degenerative brain conditions like dementia. There is something that can cause convulsion only in women and only in pregnant women. Okay, and that is called eclampsia. So these are the causes of convulsion. So if you see someone who is convulsing, it could be any of these. It could be something else that I didn't remember to mention in this video. Some manifestations or symptoms of what convulsion. Number one, that most commonly you will see is jerking movement of the limbs. The person will be doing like this. So that is number one. Upward rolling of the eyes. Upward eye roll. Let me just leave it like this because of space. So upward rolling of the eyes is one of those manifestations. Now, 3, incontinence. Could be rectal, it could be urethral. All right. Now, the person may have loud shouts. Okay. Now, the person may also have cry. Then, loss of consciousness, LOC, loss of consciousness. Foaming, also common. Foaming in the mouth. Okay. So these things are the manifestations of convulsion. There are some others. What are the things that you should never do to someone who is convulsing? So, mites, very harmful mites that you should avoid. Number one, many people will try to put something in the mouth. Spoon. I have seen somebody that put fork in the mouth and the patient sustained severe injury that was even on after the convulsion has been stopped. Don't put anything in the mouth. Most commonly, you guys put spoon, but I've seen fork, and there may be others. So don't put anything in the mouth. Some of you will start bringing the eyes down because the eye is going up. You want to pull it down. Please leave the eyes alone. Leave the eyes. I have seen people that put onions. They squeeze onions. Some even just break pieces the onions and force it into the eyes. For what now? What will it do? And recently I've seen balm. Somebody that puts rub balm inside the eyes. So whether it is balm or onions in eyes, Biko, stop. Please stop putting onions or balm in the eyes. I hope you can see this board. All right. Now, 4, I've seen somebody that put the leg inside hot water, and that thing caused severe cellulitis that was almost leading to osteomyelitis for that patient. Okay, so please avoid hot water. And even whether cold, some people will say pour water. Avoid cold water. I've seen somebody that painted the child with charcoal. Don't paint with charcoal. Charcoal. Avoid charcoal. It will not do anything, and they even force some in the mouth and the eyes. Avoid that. Now, some will put this palm kernel oil, enoaki, inside the mouth, like for the person to swallow. The most dangerous thing that you should avoid is putting liquid or food inside the mouth for the person to swallow. Avoid because they not in Igbo, sorry, but I'll still put it in Igbo. Enuaki. Avoid enuaki, that's palm kernel oil. Olive oil. Only because you want to pray for this person. You have anointed the forehead, then you still want to put the olive oil, pour it inside the mouth. Avoid olive oil. In fact, avoid anything that goes inside the mouth, whether it is liquid or food. Nothing should go inside the mouth. Okay, The reason is that this, when you are putting it inside the mouth, the person, remember that some of the symptoms we mentioned is loss of consciousness, and then at that time their muscle is not even coordinated, so the swallowing reflex will not be in order. So this thing that you are putting inside the mouth might go into the lungs and not the stomach, and when it goes into the lungs, problem don burst be that. You are no longer having only convulsion, you are now battling with aspiration, and this is what will kill the person. Okay, so avoid this. And then some people give urine, so anything that goes into the mouth, avoid it, urine inclusive. Avoid it. All right, now these are the harmful practices that you should avoid. So what should you do? Before these actions, there must be a very important inaction, and that is what? Calmness. Calmness. If you are not calm, you cannot handle a convulsing episode. So first of all, you must be calm. You must check the environment where this person is. If there are harmful objects, sharp objects, knife, razor blade, stones and the rest, remove them. Okay, so remove harm. Check if this person is having a very tight fitted belt, tight fitted clothes, remove them. Remove tight clothing, both belt, tie, shirt, singlet, body fitted, whatever, remove them. The person should be free. All right, now if this person is on the floor, please get a pillow and put under the head, so he will not hit the head on the floor. Get what? A pillow and put under the head. Now while you put that pillow under the head, remember we said you should not put anything inside the mouth to avoid aspiration. You also do something here to also avoid that aspiration because of the foaming that can go back, trickle down into the lungs. So you put this person on a lateral position, left lateral position, just like the way I am now. This is my left side, so the person should lie like this on the left side. So your position is what? Left lateral position. Another thing that you will do in action is what? Don't restrain. Do not restrain. Those jerky movements, leave the person to jerk. If you are coordinated enough, you time it. Time it. How many seconds? How many minutes? Now, once you start timing, you are waiting for the convulsion to what? End. Then you do what? You take the person to the hospital. Now, if this time is more than 5 minutes, if this time is more than, it goes more than 5 minutes, the person is still convulsing, you start going to the hospital. But if it stops, you take the person to the hospital after the convulsion has what? Stopped. So go to the what? Hospital. Okay, so the reason why you are going to the hospital is for the doctor to know what is causing that convulsion, because convulsion itself is not a diagnosis. So when you know what is causing the convulsion, you can stop it from the root cause. All right, so these are the things that you should do while at home, and remember those ones that you should never do. They are very, very harmful, and they can even cause the death of the patient while the convulsion doesn't do much. Okay, so I believe you learned something from this video. Please, if you have any experience of this convulsion, your neighbor, your relative, please comment, share this video, because the problem we have is that most people that practice these things, they are not even on this platform. They don't even have Android phone, but I believe some of their relatives, cousin, nephew, niece have. So the more that we will share this message, the more we will have public awareness, the more they are going to have the opportunity to see this in one way or the other and take corrections. All right, so this message needs to be shared. Okay, then you can consider following me. I am Dr. Chinedum Benjamin, and I share vital health tips that will help you to live your best life. And I shall see you tomorrow.